Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, the patient with nephrotic syndrome can also have renal vein thrombosis. So, what are the causes of renal vein thrombosis? Renal vein thrombosis can occur due to the increased fibrinogen or increased lipoproteins, reduced antithrombin 3. Increased fibrinogen, increased lipoproteins, and reduced antithrombin 3 are the causes of nephrotic syndrome. Are the causes of renal vein thrombosis in nephrotic syndrome. Now, what are the conditions which are associated with renal vein thrombosis? Conditions associated with renal vein thrombosis are in renal vein thrombosis occurs whenever there is associated with trauma, extrinsic compression, extrinsic compression of mainly the lymph nodes, or there can be extrinsic compression of the aortic aneurysm, or it can occur due to a tumor. So all these will result in renal vein thrombosis whenever there is invasion by renal cell carcinoma, or if the patient develops dehydration, especially in the infants, or if the patient develops nephrotic syndrome. This nephrotic syndrome is present, especially this nephrotic syndrome is due to membranous glomerulonephritis or presence of pregnancy and oral contraceptive pills. So all these are associated with nephrotic syndrome in adults. All these are associated with renal vein thrombosis. All these are associated with renal vein thrombosis in adults. Now, what do you do for renal vein thrombosis? The investigation done for renal vein thrombosis is, first we can do CT angiography. Actually, CT angiography is the most sensitive investigation. It is the most sensitive investigation which is done for renal vein thrombosis.
thank you and thank you for watching.